Welcome to the Physician Education Webinar Series by Apex Biologix. We are happy to have you guys join us on this wonderful topic. For those who don't know about Apex Biologix, a little history about us is we started about 5 years ago at a point of discovery for a lot of physicians who are just learning about regenerative medicine. We are a complete resource for regenerative medicine, providing specialized training, comprehensive business services, and high-quality supplies to improve practices and enhance the lives of the patients they treat. We are pleased to have Dr. Mathew Peterson join us today on a subject that can either make or break the success of a physician's regenerative medicine practice. A little intro to Dr. Peterson. Dr. Mathew Peterson has over 18 years of experience in the field of medicine, including 13 years as a pain physician. His overall goal is to provide services for patients to decrease pain, increase function, and reduce the need for medications. Dr. Peterson utilizes minimally invasive procedures to diagnose, treat, and potentially heal the source of pain. He is highly trained and experienced in the field of regenerative medicine and has traveled across the globe in order to teach physicians the latest regenerative medicine techniques and treatments. Dr. Peterson is board certified by the American Board of Anesthesiology and his work has been published in the Postgraduate Medical Journal. When he gets some free time, he enjoys traveling with his family and spending time at his ranch in British Columbia. So without further ado, we'll go ahead and turn the time over to Dr. Peterson.
Yes, good morning. Can everybody hear me okay?
Yep, we can hear you.
I'm on the chat line here. If everybody can hear me, just go ahead and throw me a couple chats here. I'm up in Alaska. The internet connection's a little bit spotty up here. So I just want to make sure that everybody can hear me. We're not having any IT issues. Okay, yeah. All right, so we'll go ahead and get started. Well, thank you, Kaho, for that introduction. I really appreciate that and appreciate the opportunity to get together with all of you this morning and share some of my thoughts on how to market and transition patients from a traditional insurance-based practice to more of a cash-based practice. I think as physicians, we all struggle with how to sell these services. We're all used to an insurance-based model, and this whole transition to cash-based certainly for me was a very big transition. It was, from my standpoint, very difficult. I don't think I had the language or the psychology behind transitioning to a cash-based practice. I think if a physician has an understanding of more of a cash-based practice, such as a medical spa or aesthetics, they probably have a stronger skill set than what I had when I started this journey. But just a little bit about me. I've started a web page and a Facebook page called Regenerative RX, and I started that last summer when I really started looking at what's my marketing journey here, and I started looking at what do I need to do to take my practice to the next level. I've been playing with Biologix for about 15 years and slowly developing a lot of the uses that are being developed today with platelet-rich plasma and stem cells. I've played with adipose tissue and bone marrow. I've certainly played with a number of other tissues, the amniotic derived and the umbilical cord derived products. And slowly over my career, it wasn't the technical issue I was having a hard time with. It was, again, just selling this to the patient and getting them to spend, thousands of dollars to have this procedure. And I think the biggest message that I tell physicians that are starting to go down this journey is you really need to believe in the therapy yourself. I think from my standpoint, early on, it was really discovery. There was nobody teaching this. It was things you were reading in a journal, and this was long before Apex or some of the bigger organizations having formal conferences. And so you're reading about stuff in journals and you're trying it on a case-by-case basis and really developing your skill set. But slowly over time, I developed a skill set that I don't feel like I no longer need a long-term study or a randomized trial or anything like that to tell me that Biologix is working well or that it gives me a good clinical outcome with the patient. And once you have that discovery in your own professional career, then I think the message is that we're not selling this to the patient. really it's how do we best serve the patient. And I think if you take it from that psychological perspective, it really becomes clear that it's not in our best interest. It's in the best interest of the patient that they need to really take a strong critical look at this. And so then your behavior changes, your psychology changes, your language changes, because you're not trying to sell a procedure. You're really trying to help the patient. So trying to focus more on how do you serve that patient. And so through that journey, I went and hired a number of marketers and started looking at how can I sell this? How can I develop the language that can help me deliver that message in a more impactful way? And so the slide deck and what we're going to be going over this morning was a part of that development. When we go through this slide set, what you're going to see is kind of a psychological breakdown of the selling process. And this slide deck we actually came from a very professional marketer that sells from stage. And when you look at these marketers that are selling from stage, it doesn't really matter what they're selling. It's the psychology of the message that you're selling. And that's really what I wanted to talk about this morning, was the psychology and how you take, in our case, a patient down this road of the psychology of what they need to do to understand not so much what we're selling, but how we can serve them, how we can help them, and at the end of the day, proceed forward and ultimately spend thousands of dollars with you to have cash-based services in your practice. So with that, I'll get started in this slide deck. So the first slide is when you start your presentation or when you're talking to a patient, you need to establish an introduction and rapport with the patient. I think a lot of physicians that I've worked with that are younger in their career or just starting out are still focused on their own issues as a provider, trying to show the patient that they're the expert, and really the patient's not there to hear that they're the expert. They're the first visitor, so you really need to develop this rapport with the patient. And very quickly you can do that early on with just telling them a joke, telling them a story. You need to relate to them at a personal level and not jump right into, I'm a doctor that practices stem cells and the stem cells are the greatest thing. It's more about relating to the patient and understanding from their standpoint, why are they in your office in the first place? So you really need to develop that rapport with them. And one of the easiest ways is to tell them a joke or get started with a story that can relate to them and some of the issues that they're having. And then, kind of quickly, you want to, at that point, go into what they call a quick epiphany bridge, which is, again, to build rapport. An epiphany bridge is, if you think about your journey with Biologix, where you started, when you first started looking at Biologix, whether it was PRP or stem cells, why did you go down this journey and why are you now on this lecture here today? You've went through yourself this transitional or transformational journey of believing in this therapy. And, the patients aren't here to hear about your journey from a standpoint of understanding the science of, well, it's the CD34 cells or it's an adipose-derived cell or anything like that. Patients don't really understand that science and they don't really want to know that science. They want to know that it can help them. They want to know what can help them, not necessarily how it can help them. And your epiphany bridge will help take them down that journey. If you can relate that back to when you first started this, think back when you knew really nothing about Biologix other than the intrigue or the fascination, or you heard someone talk and say, wow, could I really incorporate that into my practice? I wonder if that would actually work. So for example, in my my case, my very first patient with Biologix was a patient that was involved in a motor vehicle accident, a head-on collision, and had ruptured the inner spinous ligament between the T12 and L1 vertebrae. And as an interventional pain specialist, doing a lot of facet blocks and epidurals and all of the traditional things that we do in pain medicine, nothing was really helping, but I could consistently do a diagnostic anesthetic block of the inner spinous ligament, and the patient would have immediate pain relief, and she would get off the table and be able to bend, twist, move, and do everything I would ask her. And she would say, "Wow, that's the source of my pain." But it led me down this journey of, well, okay, I feel fairly confident the diagnosis of her pain is ligament pain at this point. Granted, we're going back about 15 years now, and interestingly enough, 15 years ago, we were taught that ligaments don't even hurt. I think that's kind of a bogus thought at this point. But 15 years ago, you look at the literature, and ligaments don't really have a very good nerve supply. They're not a structure that has a source of pain, which seems comical in today's arena. But I ended up doing a PubMed research and found that there were some biologics being used. And so I thought, well, could that work? And ultimately treated the patient, and it was an N of 1, but it was a remarkable result, and it led me down this journey where we're at today. But that epiphany bridge of you guys understanding what I'm telling you now, you need to develop your own story that can relate to the patient, but it's your story, but you're relating it to the patient in their language so they understand how you got to where you're at and why you believe what you believe will help them. And you're going to do that twice. So the first part of this epiphany bridge is really just a quick introduction so that they're intrigued and understand and are willing to listen to you for the next hour as you're giving your presentation or you're talking to them in your clinic. And then you want to quickly go into a case study, kind of a before and after, showing some of the results that you've had. Again, nothing real long, but just here's one of my patients. This is before and after of the result, kind of like what I just went over with you guys. And then the next part of the psychology of it is you want to go into the new opportunity, which is the use of biologics, the new opportunity. And what that means, you want to kind of have a qualifier in that you want to go through who is this for, go through the indications of who you're trying to treat, and more importantly, try to weed out who it's not for. Obviously we went over my journey of biologics as a pain physician. 60% of my practice was government insurance, whether it was Medicare, Medicaid, and all of the patient profiles that, some of them were, they were all very good candidates for the procedures themselves, but the demographic was in such a way that they could never afford some of these procedures. And so it wasn't until you really start marketing and going after the patients that you're really trying to target that those your numbers will start to increase from a patient standpoint. The next part of the psychology of this whole cell is the big domino, or the goal, the big domino that you need to overcome. What is stopping the patient from going forward in having a biologic? I mean, we all have some self-limiting belief of why this would not work for you or them. And that one big domino we need to overcome. Some of them think that there's no way this injury is going to heal. Some of them think that orthopedic surgery is the only way to fix this problem. Some think it's just voodoo juice we're injecting into some of these joints. If it really worked, insurance companies would pay for it. These are all limiting beliefs, and whatever that big domino is for the patient, we need to overcome that during our presentation so that at the end of your presentation, they have this thought of the only way to heal this injury is to go through this biologic procedure. And so then you start going into qualifying yourself. Why should they be listening to you at this point? What is your training? What is your expertise? What sets you apart differently than all the other guys that are doing this? This is still an early market, and there's not a lot of people doing it, but there's certainly a big difference in what's being done. Everything from mid-levels, nurse practitioners and PAs being hired by chiropractors to just do simple joint injections with amniotic products, all the way up to someone like myself that practices a full spectrum of interventional orthopedics. That I can do anything from an amniotic product all the way up to bone marrow or adipose-derived tissue, and doing bone augmentations and a lot of the interventional orthopedics of drilling into the bone marrow, whatever surgical technique I need to. A lot of the techniques that I do, probably I could not even do in the lower 48. That's one of the blessings of living up in Alaska, is I have my own surgery center, and living on the edge of society, I can get by with a lot of the things that many people probably cannot, because I'm not governed by the politics and the red tape of medicine and other medical colleagues. But it's allowed me to develop a lot of the surgical techniques that I do with Biologix. Again, why you're qualified, some of the photos, if you have photos of videos or certificates of your journey and your education of why these patients are listening to you. And then you really get into your epiphany bridge, which is your origin story, and you really want to go into the detail of, how and why this patient would follow you down this journey. Again, if you think about this epiphany bridge, you start with your backstory. What is your backstory that gives them a vested interest in your journey? Think about, again, you're going back to the intrigue of when you first started. And then you went down this journey of understanding, educating yourself about Biologix, including getting on this webinar this morning. This whole journey that you've been on, why are you on this? I mean, you're intrigued enough and believe enough in the therapy that you're here. The patient needs to understand that. So think about if you're going to go into the other room and take that patient by the hand and hold their hand as you're walking with them down this journey of telling them that story. That's basically the epiphany bridge that you're telling them. You're not giving them the scientific background. You're telling them about your journey and why you're intrigued and why you think this will help them. And that starts with your backstory of how you learned this process, where you learned it, and why it would be interesting to them. The other part of that epiphany bridge is the wall or the obstacle that you had to overcome. The obstacle early on for me was, ligaments should heal. 15 years ago, I mentioned that ligaments were really not even thought to be a source of pain. But here I had a patient that very clearly had a source of pain that I could reliably block with a local anesthetic, and the pain would go away completely. And so it really challenged my whole thought of, well, this is ligament pain. And then as you really go down this journey, I started to discover, well, it's ligament pain, it's tendon pain. And these tendons and ligaments at the time of injury, many times the traditional therapies of what do we do with it? For example, let's say a sprained ankle. Most people would say, well, we ice it, we elevate it, we compress it, we take our ibuprofen. And the interesting aspect of all of that is it stops the inflammatory response at the acute injury. It stops the blood flow, it stops the inflammatory response, and therefore it stops the healing. And 3-4 months later, this injury hasn't healed, and we wonder why. And so, it really changed my paradigm of, I don't treat acute injuries with ice and ibuprofen, compression and elevation. I really want a strong biologic response at the time of an acute injury. And so I quit using NSAIDs, and I had no issue with a joint or an injury swelling or causing pain. I would get more aggressive at treating the pain with opioids or muscle relaxers, but I would certainly stay away from the NSAIDs. And so again, during this epiphany bridge, you will have a wall that you can share with the patient of your journey that you had to overcome and why you felt like this therapy was effective. And so the epiphany is what you experienced and the opportunity that you discovered. Well, the opportunity for me was, we were stopping healing with all of this traditional therapy. And now we had these chronic injuries, these tendons, these ligaments that did not heal properly. And I explained it to patients that these were like an overstretched rubber band that did not break, but was stretched. And when it's stretched like that, it's weak and it allows for joint laxity. And so now the joint is no longer stable on a micro level. So it doesn't take much for them to feel pain, and it gets displaced. So if you're talking about the shoulder, they're more prone to rotator cuff tears or labral tears. Again, if you're talking about the hip, you're prone to labral tears. If you're talking about the knee, you're prone to meniscus tears. And as this goes on, you start wearing out articular surface. And if it goes on long enough, you start getting end-stage osteoarthritis. And the ultimate result right now is that we do joint replacement surgery. And so for me, the discovery and the epiphany was Biologix is the new tool in the toolbox that takes a patient that has failed conservative care. They're 3 months post-injury, post-physical therapy, all of the things that we consider standard of care in your practice. If they're 3 months out and they have not healed, the likelihood that they're going to heal on their own at that point is getting smaller and smaller. But they're also not really great orthopedic surgical candidates. They're not a joint replacement candidate at this point. And Biologix do a remarkable job at tightening up those ligaments, tightening up those tendons, repairing articular surface. And so for me, it was the new tool in the toolbox that profoundly changed the way I practiced pain medicine, because it was no longer me doing steroid injections and prescribing pain medication to treat symptoms. I was now actually repairing tissue and fixing the problem. And at this point, I feel like Biologix is going to replace about 80% of orthopedic surgery. Orthopedic surgeons really don't like to hear that. Certainly in my community, most of them don't support me. But like I've said, I own my own surgery center and I practice the way I want and do what I want. And that's just the way it is for me. So, it's been more about the best interest of patients, good patient care, and getting away from the politics of medicine and what held me down in the lower 48 and what drove me up to Alaska about 5 years ago. So that, I'm kind of sharing with you my epiphany bridge and my journey. Every one of you will have your own story that you will develop and practice and rehearse over time that you'll share with the patient. But again, I'm not talking about, if you notice the way I'm talking, the science behind a stem cell and all of the technobabble of what you and I as physicians or providers would say to each other. Remember, we're talking to patients and trying to take them, and we're holding their hand and walking down this journey of why we feel like this biologic will help them. So the plan that you created for me, the plan was the use of Biologix and how we're going to use Biologix and rehabilitate that injury. The understanding that this is not a quick fix where I'm doing a quick joint injection. It's you come into the clinic, I do a joint injection, and you leave magically healed. I'm doing an injection and you're going to get a biologic response, and the body's going to go through these stages of healing, and that takes 3 to 6 months to heal. It involves physical therapy, it involves nutrition and supplements, but ultimately through this journey of not just a joint injection, but really a joint restoration protocol, 6 months from now, the patient and I will be having a completely different conversation as they return back to their normal functioning. You want to talk about some of the conflicts that you experienced along the way? The conflicts for me and again, these are the limiting beliefs that patients are having that we as providers even have early on in our journey. Why would this work? How would this work? I still get orthopedic surgeons in my community telling my patients, this doesn't work. There's no science behind it. And, when you really look at it, there's not a lot of magic behind what we do. You really have to question yourself, does the body have the ability to heal itself or not? And, if you're still questioning that with, I'm not sure, or if it's not a profound yes, just go cut yourself in the kitchen and then call me back in 3 weeks and let me know if that wound is healed or not. For most people, that wound is going to heal just fine. And, we're talking about some kind of injury where the body is designed to heal that injury. And we're just taking a biologic substance and stimulating a healing response. And, there's a lot of debate in the industry about, well, is adipose better than bone marrow? Is bone marrow better than exosomes? Or is amniotic tissue better than umbilical? And, I've played with it all. And the reality is all of it works. I don't think any of us can stand here with a strong commitment of data standing behind us and say bone's better than fat or umbilical stem cells don't work. I think all of it works in that it stimulates a biologic stimulus that promotes healing. I think as this industry develops, as we continue to gather data, as we continue to learn as an industry, the protocols will develop over time. But right now it's kind of the wild, wild west with what biologic you're using. But to be honest, I think it's more an issue of your surgical technique. How are you injecting it? I think if you compare my outcomes to someone who's just doing simple joint injections, I think our outcomes would be profoundly different. You heard me talk about the language of I'm doing a joint restoration. I'm not doing a joint injection. My patients, my journey is that you're going to come in and I'm going to do an injection into the joint, but I'm going to be using ultrasound. I'm going to be using X-ray machines to specifically guide into very individual structures, ligaments, tendons, articular surface, drilling into the bone marrow. And that's just the technical expertise. And then I've got a whole team around me, nutritionists, physical therapists. So for example, my physical therapists, they do eccentric loading of these tendons and ligaments. And, the whole rehabilitation part of it is just as important as the injection part of it. And the whole biology is a 3 to 6 month process. So when patients buy into that, they know they're going to be into your practice, for a 3 to 6 month investment. And it's not that we're selling them a quick, $6,000 to $10,000 joint injection, which, many patients, that's what they're getting in some parts of the country. With, a lot of marketing and efforts, patients are just coming in, getting a simple joint injection with a nurse practitioner and being sent on their way. And I'm not saying that doesn't work. I think, there's many patients that have had that done and they're getting a biologic response and they get improvement. But is that the best protocol? I don't think so, but I think over time we will develop those best protocols. And so again, what was the end result that's achieved? The achievement was, for me, it was the joint restoration and basically getting back to some level of functioning. So what was the transformation? The transformation is that the patient's getting back to a level of functioning without surgery, without all the downtime of surgery, without all of the dysfunction of surgery, without the risk of surgery. For me, it was a transformation of I'm no longer just treating symptoms of pain. I'm actually fixing the problem. And I've certainly seen that in my practice with some of my business partners that continue to practice pain medicine. They have patients that come in month after month for refills of their opioids. And I have patients that come in, I treat them, I see them, sometimes 2-3 times a week for 3 to 6 months, but they're gone. After that, they're back to full functioning. And it's sometimes 2 or 3 years before I hear from them again. And they're coming back to me because they've got a new injury or they're back to their sport and they've had a different part of their body injured and they want that healed. So it's a completely different transformational practice experience and certainly much more rewarding. So after years, you want to share with them what you discovered, which was the hard way of, for me, it was just treating symptoms and, the downside of pain medicine. And then ultimately leading them into this new opportunity, which was Biologix. Again, you want to liken this story to them. You want to get into the patient's psychology of their self-limiting beliefs or what is holding them back, and you need to relate your story to them. And if you look at their story, in your story, you need to talk in the language with your story where you are encouraging the patient's dreams. You need to justify their failures. So they've had 4 knee arthroscopy procedures and why is this knee just not healing? You need to allay their fears that this is going to be a lot of money and it's going to be just another surgical failure. You need to throw rocks at their enemies. Why is the insurance companies not paying for this? Why does my orthopedic surgeon continue to tell me that this is not going to work and I need a 5th knee surgery? You need to confirm their suspicions. So in your story, if you're addressing all of these concerns, these patients not only are willing to pay for a procedure, but they become some of your biggest raving fans. When you get a good surgical outcome, they're out there telling everybody. And that is, in the end, some of the best marketing that you have. So just kind of a summary of, as you tell your epiphany bridge, this is the story. You're starting with your backstory. And, Again, talking about the wall and the obstacles you've overcome to get to this epiphany of your biologics, your journey, and then the plan and the conflict, and then ultimately the achievement and transformation that you and the patient will experience together as they go down this journey with you. At this point, you want to show people the results that you're getting. And so, as you do this, you want to definitely have a library that you're developing of videos and pictures and testimonies of patients. And you want to share that in your presentations. You want to continue to clarify who this is working for. For example, if you treat spine, whiplash injuries in the cervical spine, or herniated discs, or labral tears in the shoulder, ACL tears in the knee, again, qualifying everything that you're treating and who is this working for. You want to, at this point in the presentation, you want to start breaking down their limiting beliefs. They still have some limiting belief that's preventing them from going forward, and you really need to start addressing that for them in the presentation, so that as you're going through this, they can start to understand and start to change their psychology. And some of the biggest limiting beliefs I have to overcome for patients in my practice is overcoming the two authorities that adamantly oppose this from a patient's perspective. And I think patients listen to insurance companies, and I think patients listen to orthopedic surgeons. And both of those governing bodies at the present time really do not support biologics. And so you need to understand why those two industries are not supporting this, and you need to have some kind of language in your presentation that overcomes those limiting beliefs. For me, insurance companies ultimately, I think, want to save money, but when they start looking at the data, it's just like us providers. There is no good data, and they're trying to say, well, am I going to pay for a bone marrow procedure when I've got another guy down the street saying this stuff really works well with a adipose-derived procedure or an amniotic procedure? So insurance companies are basically just sitting on hold saying, show us the data of what actually works. And that's really on us as providers over the next years, is develop the protocols, develop the data, and show that, hey, we've got good clinical outcomes, and you should be paying for these procedures. But until we have that kind of data that's consistent and we're all kind of coming together and united, and this is the best clinical protocol that's been developed, I don't see insurance companies coming on board anytime soon. And then with orthopedic surgeons, again, it's the language of interventional orthopedics, and the use of biologics is going to change about 80% of orthopedics. If it can be done with an arthroscope, it can probably be done with biologics and avoiding the surgery completely. We're still going to need orthopedic surgeons for big, open fractures and ultimately joint replacements, but a lot of the bread and butter cases they're doing, this is definitely a direct threat to them. So they're not going to go down lightly as far as the economic impact to their practices. But interestingly, over my 15-year journey of doing this, when I first started doing this, it was an adamant no, this will never happen. And now when I go give these talks or I attend conferences, probably a third of the audience is orthopedic surgeons. And when you look at the group of orthopedic surgeons, it's the young orthopedic surgeons that either are finishing their training or just finished their training. And I kind of liken it to laparoscopic surgery. Think about when laparoscopic surgery was developed. You had these old surgeons that would just open the belly and do their surgery and close you back up. And then all of a sudden you had this laparoscope and a young surgeon that would come in that grew up playing PlayStation, and he could do everything with the scope inside the belly. And all of a sudden these older surgeons either had to very quickly come to speed with learning laparoscopic surgery, or they had to retire. And that transition took place a number of years ago, and we don't even question it at this point. But interventional orthopedics is doing the same thing. Interventional cardiology did the same thing about 10 years ago. Just think about how often do we do open heart surgery now as opposed to interventional cardiology and everything being done with stents. So the technology is real, the industry is real, it's happening. And I think when patients start to understand this, the industry will come around. So at this point, we've overcome a lot of the limiting beliefs that prevent patients from going forward. And you need to restate the new belief, which is the undeniable truth. You know, if they have an injury that has not healed and they've done all of the traditional things with conservative care and they don't want to have orthopedic surgery, you know, what other tool in the toolbox is available to them? There really isn't one other than this one. The undeniable truth is that this is the only valid treatment option for them. And as they start to understand this, it's not really an issue of price. It's an issue of when can I get it done? So the new way, a better way, is the use of Biologix. And then again, we're qualifying this even further, showing patient results, again, confirming, you know, again, remember through this whole process, you're breaking down the psychological barriers for the patient. So you want to show the patient's testimonies, and then you want to come back to it and show them further testimonies, before and afters, and videos of your clinical outcomes in patients that, you know, again, are your raving fans that you will develop over time.